for today's agent training, I'll be able to walk you through the Connexure platform and using the site. We'll start from a broker's perspective, but along the way, I'll also throw out some suggestions or what we like to call kind of happy paths that agents like to use on the site, as well as see some of the new features for AEP this year. Can I get a quick confirmation? It looks like we can see the screen okay?
Yes, we can. Thank you.
Excellent. And I also understand this is being recorded, so you'll be able to reference this back as well. So without further ado, and saying yes, keep utilizing the chat and echoing Jen's housekeeping items. I will save time at the end and we'll get to questions there too. So first things first, logging into the broker site from an agent's perspective, one of the first stops and kind of main pieces of navigation, if you will, is the dashboard. See what I did there? Just a little morning humor to break it up. If you find the gear icon, that's going to also show you where the dashboard lives. But this is essentially the main stop when agents log into the broker site experience. Some additional tools that you'll see below that kind of header dashboard are going to be tools like the reports, so the insight reporting and agent training materials. So I'll elaborate on those a little bit more in a second. But what these titles are, they're referencing various tasks in my queue. So you can already see I have a quote to follow up on that I've sent, and I've already assigned a due date a couple days out. So there's also going to be, as I said, various agent tools that you can utilize, like these tasks that associate to these various touch points or call to actions. MyMedicare.gov connections, it's very similar to Blue Button. So you have a way from the prescriptions modal and workflow to send an email request to a member who might utilize a MyMedicare.gov account and securely is able to log in, and it'll download the last 12 months prescription data. So as I mentioned, there's lots of different ways to collect information, and that's one way of collecting prescriptions, but I'll show you some of the other kind of built-in ways for collecting that. Let's navigate to reports. So as I said, there's in the tool built-in reporting, and essentially adding your username. And I'll just preface this red box as my password saver, so don't mind that. This type in the dropdown are the three types of reports that are accessible to you to pull in these 31-day snapshots. Now, essentially, all you have to do is update the date range where you want to see the snapshot. And then what you'll get is a CSV file that you can download from the report. And as you can see, these can be enrollment reports, health risk assessment reports, or scope of appointments. I don't have a lot of members in my book of business, so it wouldn't make sense to pull a report right now because we wouldn't have anything. But just in terms of how the tool works, you get that CSV file, it shows the contact information, member address, and various touch points in that report. So just know there's a lot of tools already built in that are accessible for you. Another great resource is agent training materials. So think of this as the Connexure 360 learning, basically the Connexure library of how to use the tech and the various features here. We'll be covering a lot of those trainings today, but just know that you can always go back to your assigned group when you log in, which kind of curates based on what sites you're connected with those experiences. And you can kind of think of it like this. I kind of see the path as the book on the shelf or the overall topic with lots of various chapters to read along or really watch. There's a lot of videos in here. And then I kind of think of courses as the representative chapters. So the chapters of those books on the shelf. So as you kind of scroll through or you begin to search for a particular action, like maybe it's generating a scope, or maybe generating a quote, you can search for those various trainings there and look for particular courses or paths that way. So as a distinction, I like to think of this as the Connexure platform training. Anything related to your certification, your selling permissions, you'll want to reach out to your uplines, your admin of the site, and they'll be able to help you there from the agency standpoint. So what you're seeing here are some various results, training playlists, and activity. Similar to your socials, there's notifications here for activity and ways you can curate the playlist, and jump back to that and save progress. I also like to show the suggested learning need because as a platform, we're built the way agents wish to work. So there's a lot of different ways to really work as an agent, right? So if there's some training ideas you have, we'd love to hear from you. We have a generous character limit, so please share that feedback if you have any suggestions. A lot of that feedback is what also goes into features. So I just throw that invitation out there. So this is the Connecture 360 Learning. We also have a YouTube. So I also encourage folks to check out our YouTube playlists. You can also check out those videos here on, say, the Plan Compare One platform. So if you're not, for some reason, signed into the 360 Learning, you can also check out the YouTube videos here by topic. So we covered various aspects of the dashboard, from reporting tools to how the tasks work. And as we go along, we'll actually be generating more tasks. So just remember, this is where the tasks show up in one kind of list of to-dos, if you will. In the upper right-hand corner is kind of the other menu options. So agents also might spend some time just doing general plan shopping in a zip code or plan year. So you can still use those plan list page resources without a member in context. That's kind of what we refer to as working with a beneficiary and through those different enrollments, is placing a member in context, which I'll be doing here in a second, which is just searching to navigate to a beneficiary. Before we actually work with a member, though, I just want to close out a couple other agent tools that you have access to in the platform. So beyond reporting and agent training materials, as you can see, there's another shortcut to get to those resources. Basically, under the drop-down of your name is where you'll also see the agent account overview. I'd say this is another kind of main course to really take note of, because it's going to contain a lot of really great tools for you to use this AEP. Starting from left to right, you'll see this My Shopping link. Think of this as the PEARL. I'm going to throw another acronym at you. The PEARL, known as the Personalized URL. The Agent PEARL is specific to you as the agent. What it essentially is a consumer-facing or a member-facing shopping link that you can distribute to your book of business. And as the beneficiaries interact with that link, they're then presented with the ability to shop for plans in their area, but you're still in the conversation as the agent in context. So what that looks like here, we're going to switch perspectives here and see what the beneficiaries receive when they engage with your PEARL link. As they're presented, and they put in a zip code to kind of narrow down the first filter into plans available in the area. The members are also prompted in the same preferences flow that I'm going to elaborate on further in the training. But think of preferences here as member-specific preferences to help curate and kind of aggregate up the best fit plans here when we get to filters and the product plan selection. So again, just to kind of close out from what a PEARL is, it's a consumer-facing link, and that's what we're looking at in this perspective here, where you as the agent are still in context in the conversation to retain that credit for that enrollment. What you're seeing here is a personal code. So if by chance the consumer has not created an account yet, they are prompted to, and they can save progress. Another way is they can save their progress here, pick up where they left off, and share that personal code with you to pull up that same shopping session for you as the agent on your side. So in navigating back to agent account overview, there we just touched on the agent PEARL. What you're seeing in the center console here is one of our vendor partners, RetireFlow. Some folks may be familiar with RetireFlow. It's essentially, they're a vendor partner of ours that created a 10-question consumer-facing survey. And it's a way to send that out and basically allow consumers to update their client profile information. And it saves some time because it's a self-service consumer-facing tool that agents can send out. So that's an optional sign up. And that's just the link for that optional program if agents are interested there. Right-hand side of the agent account overview, this is where you're going to see your profile picture real estate. So if you'd like to utilize this space, the default is going to be your initials. Unless you want to upload your profile picture, you have the option there. Further down, you're seeing one of the other releases in terms of features to the site, which is kind of an update to how supplemental benefits are organized. So we'll also see how these show in the new plan card designs as well in terms of supplemental benefits. But as a tool, right, personalized benefits and as a feature, this is a curated, favorited list of supplemental benefits for the agent. So you'll notice that by default, those supplemental benefits include dental, vision, and hearing for the agent. If there's anything beyond that, say a meal benefit or other benefit, maybe over-the-counter hearing aids, that say a lot of members in your book of business use these a lot, you can save a curated favorited list. I can even remove the default there of dental, vision, hearing if that's not as applicable. And what's nice is it saves some time, brings that into the conversation and in context there when we get to the plan selection already. So that's supplemental benefits. Other tools really from agent account overview are really going to pertain to you as the agent, your contact information. So whatever you've populated here for personal information, your account information. I will preface, and some of this just comes with being agent trainer. I'm looking through the site through the role of admin. So if this doesn't look in particular the exact same as your agent permissions, it could just be a role permission between admin site or not. That's really agent account overview. So again, when we logged in, we landed on the dashboard, and then we navigated to this drop down here to the agent account overview page, which is where we're at here. For the next part of the training, I'm going to pull a member into context, and we will begin some various call to action points from collecting a scope to generating a quick quote. We'll compare some plans, and then we'll tie that in with an enrollment. So again, please continue to keep utilizing the chat for any questions. Jen's here to help keep me focused on side quests. So if you have any questions, definitely utilize that. And if you have questions at the end or need to revisit a section, save some time for that as well. Okay, so from the search page itself, you're already going to see a few different ways you can utilize this. Personal code, this is that piece of real estate we were looking at earlier in reference to the agent Pearl. So again, when that consumer was guest shopping and perhaps didn't log an account, that personal code, this is that section that you paste the code to pull up that guest shopping session from that member. I could also use this like any other search tool based on these different credentials, or I can do one click in the new updates here, which is view entire book. So with one click, I'm going to be lazy and say I like using that click. So I'm going to use that for today's search. But as you can see, this is going to be a similar output to what the report spits out from that tool of the reporting built in from the dashboard that we saw earlier. So again, I can download a CSV of these results, take that to an email campaign, a mailed campaign, whatever I need to use for outreach, maybe some calls. I can navigate directly to the member profile or see a brief snapshot of some of the high-level pertinent information. So their contact information, their registrant applicant status, the agent of record, and their last updated date. I'm going to navigate to this profile. It's also a little bit more filled out to show us some of these other features here. Starting on kind of the left-hand side of the member profile page, just some things to note. The left-hand side is going to be more information pertaining to who the member is, their contact information, as well as their eligibility checks and enrollment or quote history activity. So from kind of a high level understanding, and I have a test MBI number, so this won't work. It's fake. So you basically use your real MBI, the member's real MBI number, and then put in the Part A, Part B effective dates. Making a selection here if the member does receive extra help for paying for prescription drugs. This is basically based on what question is answered here, correlates to a various LIS level on the back end. And that's going to inform not only MBI validation, but if the member qualifies for a DSNP plan, to make sure those DSNP or CSNP plans that qualify will aggregate up in the search when we get to the plan list page. So just know there's eligibility checking for the MBI validation here and state Medicaid eligibility check built in. So you'd start here and then go through the rest here on state Medicaid check.
Morgan.
Yeah.
Morgan, before you continue, can you, there's a question in the chat, if you could just touch quickly on the call recording feature.
Yeah, definitely. And actually, this is the perfect time to start that. So thanks, Jen.
Absolutely. Thank you.
So what Jen's referring to here, and this is a perfect segue, because we're going to talk about the features on the right-hand side here, the member profile. But essentially, once you have a member in context, that's when, that's that reference I'm referring to, member in context. We'll know I have the member there in context when I can see this drop down. And then the call recording is available to enable because now it has a profile associated to work as a feature. So now it can begin. So call recording. Once I initiate the call recording, which first you want to navigate to the member profile, of course, you're going to see this kind of intro to remind you how it works and what to instruct the beneficiary as with your display number too, so they can save this to their contacts. What's happening here is it's pulling in the beneficiary's primary or mobile number. There's 2 fields for that, so there's a couple options. Or you can navigate back to the member profile, say if these were incorrect. Once I trigger the call beneficiary button, you're going to see a real-time status into that ringing attempt to call out. But before doing so, it's going to request to enable the microphone. So you'll say allow. And as that action calls out, essentially, you're going to see that call in progress and the real-time status at any point of the call. I'm going to decline. But essentially, we'll go ahead and hang up. Essentially, that timer will update once the call is connected and accepted and show you that real time, just as you would in a phone experience, logging the time lapsed. And then the MP3s of those call recordings, once I exit, they are accessible via an admin of the site. So agents can request those MP3 files. And then any notes associated will show the tracking here that a call was conducted or a call recording was initiated there. Great question. A couple other features that you're seeing part of the new rollouts that we kind of scrolled past here are the archive profile and Pearl Plus. So I'm going to start with archive profile. Essentially, and it's related to this active profile status. The question was asked by quite a few agents, the ability to delete member profiles. The short answer for that is from a compliance standpoint and as an enrollment platform, we cannot delete profiles out of the platform. However, we were able to problem solve kind of a workaround with making an archive profile feature. So think of it this way as a use case. If you have a couple duplicate profiles in the system and you want to do some cleanup, you now have the ability to archive a member profile. Or if there's a profile that's just no longer active for whatever reason, you can also archive that profile and it won't show up by default in the search results unless you trigger and enable a search for those particular archive profiles. So how this works is essentially the green means the active status. When I archive it and I go to search, so we'll remember this DRX test family when we go to search. We'll type in that last name. And I'm going to put last updated date in the sort. So if we remember earlier, the first name there was not test2, it was test. So that profile is not showing in the search. Now, if I want to show that profile again, I would go back to search and make sure I checked include archive profiles. And that's what's going to bring that return with the associated name there. And now I can see by distinction the archive profile from not only that status, but this gradation here has. So I'm going to go ahead and restore this profile because we have a few more activities to conduct. Next being the Perl Plus link. So we already covered kind of the agent Perl earlier. So it's a very similar tool, but where the Perl really is different for the consumer is it's going to copy information specific to this member profile. So my test DRX profile here, actually born October 1st, that's kind of cool. You can copy the beneficiary's Perl and those member specific informations here from their profile. So as I engage with the members, I'm basically through this Perl Plus feature copying the consumer account overview information, and I'm able to distribute that in a consumer-facing link that I can send to my member. So I'm going to show y'all just exactly what that looks like, as well as walk you through our new verification process. So another update that you're seeing to the sites is this new single factor verification process. Should look fairly similar to a multi-factor you might encounter in your personal tech. So I'm going to email the code, but essentially there's now single factor authentication where a new code generates every 15 minutes, making it more secure and making it just easier in managing those verification codes. So as you can see, I was working on this a little bit earlier. So I have a verification code, that new one, because that other one would have been expired, and I generated it. As I continue through verification, we can see the email or text there for the code. What's going to populate here is the consumer's account summary page. So now with Perl Plus, agents are equipped to kind of segment out more specifically member-specific Perls through Perl Plus, and basically send securely through that verification process there the consumer account summary, so that that consumer has the ability to see, okay, they don't have my provider information. I gotta make sure I update this. If there was an outstanding enrollment or a quote or a scope, those other activities will populate. We hadn't generated any yet, so those aren't populating here yet, but that's where these would show in the member specific, that consumer Perl Plus. So just as a distinction, this is Perl Plus, not to be confused with the Perl. You as the agent are still in the conversation. As you can see, very similar intentionality, and by design, the consumer-facing sites also have you in the conversation, or again, the consumer tools available. Consumers can also shop. So they would scroll down to follow the view plan link. So that's also part of that experience in the updated UI, and kind of merging that layout here with the new preferences as well. So both consumers and agents get to utilize this really, really awesome preferences banner. Okay, so that is Perl Plus. Agent of record information. These next sections are pretty much just activity and sections. So basically, scope of appointment activity would be logged here, various notes, various tasks that wouldn't be represented by those other categories. You could add those here. And you can navigate ahead to recommended workflow. There's really two ways to do that, either recommended workflow, or if you're already at the top of the page and you want to navigate to scope, preferences, or plans, you could navigate there. The only additional click would be the cart page. Next, we will cover scope. Now, there's a lot of various ways to collect a scope. I'd say the most common are going to be email or text, which you'll see on the left-hand side with these buttons. But if the scope of appointment perhaps was in person, if this was by phone, printing a form, uploading a PDF copy, you have all those options here. Within the email scope of appointment generating tool, you'll see the option to add a task. And now that I've sent that out to the member, we'll go ahead and switch perspectives again. And now we'll open the scope of appointment form from the consumer's view. So this is what that email will look like in terms of the branding and communications for these activities. Your friendly face will be here, or your initials, and your contact information in that outreach email. As the member engages with that scope link to complete the scope, they're presented with those next steps, and they'll check the products that apply in the scope of sales appointment confirmation form. What I'm taking note of is all the required fields to make sure I get through all my training points here. So definitely, always be thorough on forms. So hopefully the member will be way more thorough than I. And I will put my submit date. Another required question, I'll submit. And now I'm basically seeing the other call to action steps to prepare for my scope appointment with my agent. So next, I'm going to navigate back to the broker site. So we'll refresh the page, and as the agent, see those remaining steps to complete the email form of that scope. So I not only have the status to see that it was created or completed rather, but then I can jump to see the summary here, or I can go directly into completing the form, which I'm going to do now. As a distinction, I can see that these steps are now to be completed by me as the agent. So I'll fill these out. Hit today's date. And submit. So what's going to generate now is a green update status to show completed with the corresponding date and confirmation number, quick summary, and a PDF copy of that scope completed, available on the scope of appointment page. So now I can see both sides of that scope in PDF copy if I need any receipts in the platform. So I know we mentioned preferences a few different times earlier. So now we get to kind of dive into preferences. Think of this member preferences as essentially the kind of umbrella term for, say, providers. Who is the member going to for their doctor visits? Which pharmacies are they filling out those prescriptions at? What are the prescriptions that are getting filled? So any member-specific pertinent information, really member preferences, would be captured here. With some of the other additions here you'll see, including current plan and the personalized benefits feature as well. So starting from left to right, when you click into these modals, you'll notice kind of a previous call to action needs to be taken if it says add. If it's been completed, you'll read the past tense added status from that. So first, put in that provider name. It's already pulling in the zip code from the member. And now I have a split view here to utilize the map, or I can use the list view. If the provider is at more than one location, I can narrow down the specific location. If it's a PCP, new or existing patient, you can also make those allocations. Add those. And now I can see those complete status with the green check, and I can go back to view and make edits or proceed to the next modal. Within pharmacies, there's two ways I can search. I can look based off zip in the area or put in a couple characters there to generate part of the pharmacy name. As you can see, if it's retail or digital, I have the ability to navigate between both types and select what's going to be best for my member. So I'll add a few there. Seeing what the cost based on specific pharmacies, I can make a selection here and also review that from the plan list page. Within the third P here is prescriptions. So now we had mentioned earlier from the task view where it looks like when members receive a mymedicare.gov task follow-up, but this is where the email can be triggered to send that invitation. And then it shows a real status. There's the task prompt, and it shows the real status there if we're waiting for access still for that information. If perhaps I'm adding prescriptions manually, you begin to type into the search bar, select dose, form, quantity, frequency. And what's nice, right, depending on your members and information, the information once logged will live in the system. So if I'm working with a member profile that might have some prescriptions, it's just reviewing and updating. This obviously is like a fresh profile. What I've done here is typed in a brand name drug. So obviously formularies change. So depending on when you're looking here, a brand name drug may qualify for generic cost saving equivalent. If that is the case, the logic is built to locate that and present you with a prompt. Do you want to, swap out the Lipitor for the generic equivalent with the atorvastatin calcium? So I can say yes or just ignore that. I'm going to say yes now, and then we'll add that to the quote. And additional information you'll now see here too are for common conditions. So if this drug is associated with any common condition, you'll see what's called our tooltip here by just hovering over that for additional information. Subsidy we already captured here from the member profile. So that's already pulling in as completed. That's what that was. In one of these last few boxes here, health is going to be estimated health costs. So what this is it's a curated list of some of the most standard benefits offered in a plan. So of these 5, there's the common visit use case, total days. You can change those values to get a more accurate read of costs or restore to the defaults, whatever is going to be applicable. The current plan is one of the new features this year. So first things first, when you're engaging with this modal, is you'll be prompted to search for and select the particular product type. It's already going to pull in the member zip code, and then from the drop-down, you'll be prompted to select the carrier and the plan associated. Once I update that, I'll see that completed status, but I'd say the real magic happens from the plan list page where you'll see that called out. In the last piece of the modal, this is pulling in those personalized supplemental benefits. So now I can curate, let's say, because I didn't have any captured before for this member. So I'm going to make some updates here. Maybe they only use over the counter, but they do need these other benefits. So I'll update this. And when I get to plan selection, that's more member specific now. All right. So we're now navigating away from the preferences page and navigating to plan list page, where the preferences essentially becomes the preferences banner and remains in the conversation in context here at the top of the plan list page. So we can still see those completed statuses. And as you scroll past, a couple things just to note. You can make plan selections here, with the member in context. It's going to pull in their zip code associated with the member profile address. So if I need to make changes, I can change from here or the address itself. The sites are going to be dual plan year. So the default here, of course, is in the new plan year. Below that, you can see some of the separations there of product types as well, with the product titles for what types of coverages. These checkboxes, if you wanted to view plans that you were not licensed to sell with, you would check that. to view a larger scope in that zip and that corresponding plan set area and product type. So as you can see, there's various combinations depending on before we even get to filters and sorting, already various combinations depending on what plans you need to see. This add non-commissionable plan status, this is pertaining in particular to the status flag of non-commissionable only, right? So as we know, carriers determine what plans are commissionable or not. As a platform tool, we're simply showing the flag from what the carrier determines on those. And if you wanted to see that reminder around those, you can see them from the agent and broker side only. As you scroll past product types, you'll also see reminder callouts. Because we had filled out member profile information in the subsidy checks, it shows the member would qualify for CSNP and DSNP plans. So these are reminder callouts before I even get to plan review here. And as you're probably already noticing here, that current plan callout, that's going to be the distinction flag to see where the current plan is in the conversation. And we already saw how non-commissionable shows. So that's the output there for those flags. Within filters, still related kind of to CSNP and DSNP here especially, there's now an option to hide or curate here, of course, all the various statuses, but now has additionally some corresponding tooltips as well for various conditions. But your Quimby, SLIMBY status, various acronyms, if you need to isolate particular plans, you have that ability here. So filters is upgraded to be located here and have all those various touch points here that you can select. So I'm going to close out of that. Now in the plan cards themselves, from the default and how these plans are sorted is going to be plan premium, but I can also look from total estimated drug cost, low to high, a lot of different options here to change the sorting. In the plan cards themselves, you'll also notice a few key enhancements, especially. So you're going to see plan ID number, the shortcut PDF to summary of benefits now. So you still are able to scroll to view plan details, scroll to the bottom of the page and view summary of benefits. But agents were asking us to make a shortcut on the plan cards. So we added the little PDF icon there to make it faster to get summary of benefits. So if those are available at the carrier, you'll see that here. Highlights. The highlights are in particular to those supplemental benefits. So we were making those personalized benefit selections there on our supplemental benefits. This is showing that status here of those supplementals under highlights, and that's going to be visible at the bottom of the plan card. A few other updates you'll see is the iconography here for dental, vision, hearing. There's 3 various statuses, whether it's optional, included, or not included, that corresponds. So green check is all the way included. But just know there's a few different values there that would show. In the extended view, there's additional carrier information provided that would also show here. Just varies by carrier, but you can still see add-on coverage and those details here in a quick glance before the cart as well for some of these plan benefit highlights. So I'm going to add a plan to quote. Scroll to a few different carriers. I can add up to 3 plans at a time to quote. So once I scroll back to the top, I can see that summary. When I send the quote, it's pulling in the member's contact information and a default message that I can change or leave in. It just says, please review the quote. When I send this quote, I have the optional task to create here to follow up on the quote, which I'll go ahead and use that, keep me organized. And now I'm going to navigate to the member's perspective and open up the quote. So part of the update to the quoting process this year is also through that new verification process. So just like we saw earlier, we can get a verification code now, and it's our single factor verification. There's that code. So again, I've already switched perspectives, looking through the consumer view. I'm verifying to open my quick quote that my agent already sent out. And as I bypass this verification, I'll be presented with the quote. So that account summary we saw earlier, it didn't have call to actions yet. But remember, we completed that scope. So the member is now represented with a summary here for call to actions. And that new quote that we generated is available here. So as the member engages with the quote, they're directed now to the new updated interface for the quote page. So essentially what used to be kind of the quick quote page has migrated to merge with the plan list page. So basically, this is creating a more seamless experience. You're still in context for support with the member, but any other pertinent call to action updates are still now presented and make it easier for the consumer to engage with. They can view their message from you as the agent and still make plan evaluation here with these quoted plans. So now we can see that flagging and the various quoted plans there. So I'm going to navigate back to the agent broker site, do a quick comparison here, and then we'll enroll in a plan. So at the top of the plan cards, there was a check option there for add to compare. And basically, this is kind of what I like to think of as an analogy, the apples to apples comparison. So now I can see in kind of a stack across left to right and vertically, what are the plan differences? What are the highlights there? That's a nice little built-in digital highlighter. If I want to see cost based on particular pharmacies and toggle that, I have that ability here as well. And basically, there's one other layer to peel in a plan card. So if I want to view more plan information and dig a little bit deeper, let's say this seems like a good fit. I'll then be presented with the first tab being more plan detailed information. That's going to be costs, pharmacy information, prescriptions. So now I can see from these additional tabs, where do these member specific prescriptions fall, what tier, what brand, cost. The third tab is about the health cost benefits. So those were those updates, those values we changed earlier from preferences on the health benefits. And last but not least, the calendar view, as I like to call it, but it's the total estimated cost page. And it shows you this drop down here, jumping into the next year of the anticipated coverage to see where the premium costs and everything calculate to getting that monthly estimated cost, as well as the applicable phases for those drugs. So I'm going to say this is a good fit plan. You know, we've already sent a quote, so I'm going to add this to cart. And once I navigate to the cart page, what's going to populate here are some variables depending on what product type, right? Or the carrier has determined. So in this example, I'm working with an MAPDP plan, but just know that applicable call to action rate might vary slightly to what product type you're adding. So if you're looking at additional coverages, shopping hospital indemnity, those call to actions would be available here. So now I have a few different options before I continue to apply. I can view the plan details again, change the plan, remove it from the cart. What this is signifying is how the form will be completed. So it's an electronic enrollment. And it's either, you know, sending this to the beneficiary to sign and submit, complete and submit for myself assumes agent assisted, right? Because it's the beneficiary's form. So we're assisting them through that enrollment with them. So I think I need to add a 2025 plan here. Jen, I know we're near the last 10 minutes too as I acquire an enrollment. Are there any top of mind questions or areas to focus on to bring up as well this time?
Well, I'll tell you, Morgan, there are several. And, I just want to throw this out there. I apologize greatly for not keeping up with all of these questions this morning. As some of you may know, I was up until 3:30 in the morning testing your site so it would go live today for you. So I'm a little slow today, so I apologize greatly, but rest assured, I knew we would have this time to take over for questions. So I'll read some of them off for you, Morgan. How does that sound?
Excellent.
Perfect. So there's several of you that have asked about migrating member information into the system. So that's going to depend on a few different situations and such. So reach out to iPros and to your admin at iPros, and they will either.
Which is me, by the way.
Yes, which is Rodrigo. I didn't want to say because I didn't know specifically,
definitely.
but yep, reach out to Rodrigo, and he'll either give you that information or he will reach out to me, and we can coordinate that for you guys. So just so you know, depending on where the information is coming from or what have you. So just so you know for that. Will there be an option to suppress certain plans and insurance categories, like if we don't want clients to see non-commissionable plans or dental and vision specific plans?
So
Go ahead, Morgan.
because if I'm hearing the question right, Jen, it sounds like we just want to know, are consumers able to see the commissionable flags or not? It sounds like that's the question.
It does sound like that's the question.
So the commissionable, whether it's commissionable or not, is a status only available on the broker site. So it's only applicable to an agent. So that's why as a feature, it just wouldn't be available for a consumer to see. I know for agents who have asked, I want to show a PDP plan, and I don't care whether it shows non-commissionable status. The workaround I've talked to agents about is from the agent broker side. You can just pull a PDP plan if you're looking to show a specific one and do some screenshots. But just as a use case, non-commissionable doesn't apply to a consumer. So that's why you don't see it on a consumer facing anything, basically. Great question.
And then there's another one for those of us new to iPros. Will our client info that was stored on Connecture before we joined iPros be integrated into this site? Again, reach out to Rodrigo for that portion.
Yeah, I can ask that question briefly. Yes, we actually migrated all of your clients over from the Team Alvarez Connecture account over to the Health Plan Cart platform. We've also sent out several communications about that. But if I just wanted to mention, if you have any questions, because I'm seeing also there's a few questions about the missing carriers. For support, please email connecture@iprosteam.com. I will also type it in again on the chat. It's connecture@iprosteam.com. And please go ahead and submit all the inquiries and all the questions there.
Thank you, Rodrigo. The second portion of that question was, can we still use this site for SOAs and recordings, even if we have to use the carrier site to enroll? Yes and no. So if you're using the carrier site to enroll, the recording's not going to carry over. The recording will only stay connected as long as you're within the profile. Yes, you can still use it for the SOAs. That's by all means, yes. However, if you have to use the carrier site to enroll, or if it's a link out, I believe that the recording will still continue. But if you have to jump out and go into the carrier portal, then no, that recording will not follow with you. But yes, you can still use it for SOAs. And if
I may add, so you would have to, just to kind of paint the picture, you would have to create a profile for your client on Health Plan Cart. And so since you're going to be triggering the call from Health Plan Cart, and then you can have a tab open while it's recording, and then you can have another tab to do the enrollment. And if in case there's an audit or there's a sales delegation, whatever the case might be, and the carrier is requesting for that audio file of that recording, you can always go back. Well, actually, you need to request it because you won't have access to the file, but we do on the back end. So we just need to request that from us. But that's the way that you would do that.
Perfect. Morgan, is there a way to upload a paper SOA or an SOA from a different source?
So, first things first, you'll want to identify what member you're working with to collect the scope. So once they're placed in context, you'll simply navigate to the scope of appointment page. And then there's about 6 different collection methods. So I would just choose whatever is the most applicable case, from in person, by phone, printing a form, or uploading a PDF, or the email text.
Is there a test health cart where we can practice before going live just to play around in it? There is not. However, you can go in and you can play around with it, create a test account, a test profile, and view the different things. You do not want to submit any enrollments or anything like that because, again, it is live, a live platform. However, you can go through and just see, create a test account and just play around, see the different features and functions and get used to it. So absolutely you can do that. When you say we are going to have a new Connecture link, you will send that to us today, or we will still log into the one Rodrigo sent us a while back. I have lots of clients on that one. So it's the same link because it's a dual plan year link. So the only link that's going to change is your consumer link. That's the only link that will change. Otherwise, your main broker page is, and this, what Morgan's on right now, is your consumer link. And you'll know the difference between last year's and this year's because of the year in the URL. Otherwise, it is a dual plan year, and you will flip back. You can toggle back and forth between 25 and 26 within the same link.
And I just copied the URLs on the chat box. You have the consumer site that has the 2026 string there on the URL, and then also the broker, which hasn't changed. So I recommend to save that on your bookmark so you don't lose it.
Perfect. Thank you. The question was more like, if the client were to use the client-facing link, can we make sure certain plans do not show up on the client-side portal?
I guess without knowing the certain plans do not show up, I can't really speak to that. But in terms of what the consumer-facing link shows, you'll already notice non-commissionable or not licensed to sell is not an available feature here because it's a consumer-facing site. So what's displaying here are essentially what's available in the zip code or available by the agent, right? Depending on if we're looking at an agent Pearl, that would be specific to what the agent is available to sell in that respective member's zip code, or it would be just a general consumer shopping link for the zip code area of these products.
Could you go through the SOA form by phone? Could we do a test on SOA by phone, or how we email it to them on a new platform?
I don't know if I've used the scope of appointment by phone feature. Are you familiar with this one, Jen? Outside of call recording, yeah. And I don't know if already, because I collected one, it just won't. Oh, there we go. So it looks similar to the form in person. So it updates what I would believe probably gets used as a script, it looks like. Yeah. So I'm seeing the distinction here, Jen, too, where for phone, there's some agent notes as well that kind of mimic scripting.
Yep, absolutely. Does the completion date from broker on SOA need to match the completion date on the enrollment?
Jen, do you know the answer to that? I know, I
So,
don't, that might be an agency
I was just gonna say,
question.
Rodrigo, do you want to hit that one?
we covered that. Let me read that question again. Does the completion date from the broker on SOA need to match the completion date on enrollment? So this is a compliance question. Don't want to dive too deep in this, but I think there's a bit of a short answer on this. So as we know, per CMS guidelines, there has to be a 48-hour waiting period from when the scope is completed to when you're going to be completing the application. However, like for example, there, if you can just wait there for a little bit, Morgan, there you go. It says if the scope of appointment wasn't completed 48 hours in advance, please provide the details below. So if, let's say, it's the end of the month, let's say yesterday, it's 9:30, and you need to submit an application, then you would enter there end of the month. Or if your client requested the same day appointment, then you would enter that on there. Hopefully
Perfect. Thank
that
you,
answers the
Rodrigo.
question.
If it's the agent pearl, can the members see how many plans the agent is appointed with? So that, yes. So if a member is using your agent pearl, yes, they will only see the plans that you are appointed with.
Right. And I just always remind it also, of course, is aggregating based on the client zip code. So just something else to keep in mind is checking the zip if there's question.
Right where Morgan is right now on the account overview, if you have any questions on where your link is, it is right under the account overview. You are going to want to select the copy 2026 link or the copy 2025 link each time that you are going to paste it first generation. Otherwise, that link will break and then you will not be tied as AOR on that enrollment. So always make sure that if you're copying and pasting that PURL, you are copying first generation and pasting it right from there. You're not copying a copy. And then if you scroll down, Morgan, for me real quick, if you have any questions about any of your permissions, if you keep scrolling down a little bit more, you would see those right here down below. It'll list out all of your selling permissions that are entered in for you. You will not have the ability to add any selling permissions. Only a site admin can do that. However, that's where, right where it says active selling permissions, that's where all of your selling permissions and your carriers will be listed out for you. So just in case there's ever a question there, that's where you can see your carriers. But okay, so in addition to the Pearl question, but will they see appointed with 10 of 12 plans, etc.? No, they will only see appointed with 10 plans. They will not see 10 of 12 plans. They won't see anything but exactly what you are appointed with.
Generating the Pearl right here. So it's what you're appointed with, right? And then think of the zip code as kind of the container, what you're appointed with in that zip code container then.
Could the SOA be sent via email? Yes, it can be. That is, you can send it via email or you can send it via text. Also, if it's an inbound call, but not sold on that call, sold like the next day or later, is it okay for an SOA to say inbound call? Yes, that is correct. You can definitely do that. And there is, you can say, completed, it'll ask you specifically where the SOA was completed or how it was completed, what have you.
William asked if more carriers are going to be integrated into Health Plan Cart before AEP is over. William, and I think Janice also co-signed the question. So for Team Alvarez specifically, we've sent out also several communications informing you about the transition. We migrated the site. There are also things that are happening on the administrative level with the health plans where we need to merge the contracts. So currently for Team Alvarez agents specifically, not all of the carriers will be available on Health Plan Cart. we've sent an FAQ where it lists all the plans that you do have available in your account. So I know, for example, alignment is not available yet because of that administrative process, which is actually not in our hands. It's at the health plan level. So we don't have an estimated time when that's going to be completed. So for now, go ahead and use the direct carrier portals to submit applications for those carriers that you're not seeing on Health Plan Cart.
Excuse me. Rodrigo, there's also a question in there on where they can watch the recording of today's session.
So what I will do is this is being recorded here, but I always make some edits and I enter the timelines on YouTube so that you guys can fast forward to a specific section, and we upload it to our YouTube channel. So once I do all that editing, I send out a communication to all the agents that have a Health Plan Cart account so that you can watch this on demand. So yeah, that's how you can watch that recording.
Perfect. Oh, hang on, one more message.
The next
When
training
will the next training be?
Yeah, be on the lookout for communications, but we have monthly trainings hosted by yours truly. So yeah, be on the lookout for that. It's I always get confused because I also have other trainings scheduled, but I think it's the second or third Tuesday of every month. But be on the lookout because we send those out every month.
Perfect. And I think that are there SOAs in Spanish? I do not believe. Nope, I do not believe that iPros has the Spanish toggle at all. So
Is that a new feature that we could toggle on for agents?
it is, but it's an additional contracted item.
Okay, got it. Well, I know that I've also mentioned this in our trainings that this is something that agents have been requesting, but I'm glad that you guys were able to implement it, and then we can talk about it offline so that we can
Absolutely.
what we have
Perfect.
to add that for the agents.
And just so we're clear here, Rodrigo and I speak very, very regularly. So if there's ever any questions that you guys have for him or for me, please don't hesitate to reach out to him because he will bring all of that information. If he doesn't know it, he will bring it to me and I will be able to touch on it and we'll discuss it. So don't ever hesitate to reach out for that information, okay?
Thank you, Jen. Yeah, I have been using Connecture. I think we adopted the platform back in 2020, so I have learned a lot along the way. But whenever there's questions that I don't know, I always ask the experts, as we should. Pat, I included the email. We also sent out the directory with all the phone numbers, so you can reach me at the email or the phone numbers listed in the directory.
Perfect. Great questions today, guys. Great and great. Thank you for participating so much today and actually really tentatively listening. This is probably one of our better webinars, one of our better webinars or trainings that we've had where you guys have been very, very, active in asking questions and listening. So thank you for that. I appreciate it.
And it was good timing too, scheduling the launch of the 2026 site with October 1st. So making sure that we're all getting all of our ducks in a row and getting ready to have a great 2026 AEP. Again, if you guys have any questions, email connecture@iprosteam.com. And I think we went over the hour already. So
Yep.
if you guys have any last questions, we'll allow to like 10:10. Is that okay with you guys?
Yep, absolutely.
Okay. So 2 more minutes. Please send your questions. Otherwise, we will thank everyone again for joining. Thank you for engaging with us. And then hopefully, Jen, when will your next training be? Jen doesn't do trainings. I'm the one that does.
Rodrigo keeps me too busy.
Yeah. I do the trainings and then I collect all the questions and then send them to Jen. Jen is actively working with us on a day-to-day, but the relationship is that us as the agency manage the site, but it's supported by Connecture. So they're
Absolutely.
the ones that own the platform, etc. But that's how we would do the lines of communication there.
Maybe as a reminder too, I'll just plug the agent dashboard, agent training materials as folks are getting their last questions in. Do utilize the agent training material library. We do have real people reading your comments, so that helps for feedback.
Just so we're clear, the
Yeah.
real people reading your feedback on the LMS training website, that would be yours truly as well. So
We do read it. And
Yes.
as I mentioned, I kind of geeked out on summary of benefits today, but a lot of agents ask for that feature to be a shortcut. So, we do listen and take that feedback, and it can affect a product. So, do utilize the resource. And again, if you have suggestions, it's the Create Learning Need in our learning management system.
Absolutely. Absolutely. Thank you guys
All right,
all. And
guys.
thank you, Rodrigo, for the training today. And thank you guys for taking the time and walking through the platform with us.
Thank you so
Thanks,
much for
iPros.
joining. Have a
Thanks,
great
Rodrigo.
Thank you guys. Have a great day.
Happy AEP.